Hi, everybody. Welcome back to Life with a Side of Autism. I have a really special guest here today. His name is Dr. Eric Larson. And Eric, welcome to my comfy green couch.
Well, thanks, Mary.
Yeah, good to have you. Can you tell us a little bit about yourself? So I know you, but just so everybody else knows you.
Well, I'm the Chief Executive Officer for Clinical Services at the Lovas Institute Midwest. We've got two basic organizations, one that covers both the East and West Coast, and ours that covers the Midwest of the United States. And we also consult with programs in other countries, like in Switzerland and Barcelona and Canada. So spread pretty thin. We serve about 50 children in more of a boutique program in Minneapolis and the small parts of the Midwest. And also I spend quite a bit of time assisting families and other providers around the country and around the world in advocacy. And I've got an appointment at the University of Minnesota where I teach classes and develop BCBA and BCABA providers for our organization and others.
And are you on the board of Autism Speaks?
Well, Autism Speaks, I'm just on the local board of Autism Speaks. I'm the president of the Association for Science in Autism Treatment, and I was on the Behavior Analyst Certification Board. My 6 years there ended last year, and other boards. Residential program called Eric's Ranch in Montana, and assorted other programs like Little Star ABA therapy.
All right, great. So Eric's been in the field of ABA for a very long time, and his program is really known nationally for quality. So that's what I wanted to talk to you about today, Eric, was just, we see ABA centers and applied behavior analysis providers just popping up all the time, and the field is really largely unregulated. I think parents think of ABA centers as kind of like dentist's office, where they're all the same, they all have the same regulation, credentialing, but it's really not like that. So how can a parent, if they're going to go and, enroll their child into an ABA program, when they're visiting them, what should they be looking for?
Well, I think because the program is so family focused, I think it's really easy for a fairly new person in the field to think, here I am working closely with this family, they're putting a lot of trust in me, I've got this personal relationship, I should just do this with a lot of people, and have zero idea of really what they're getting into in terms of quality control for their whole organization. And the funding challenges really on this topic come back down to the funding is not for anything organizational whatsoever. So everything you do to ensure that every staff person that you hire and train is operating appropriately is really going to be an extra expense that you're not going to get compensated for. And I think a lot of the providers are thinking, oh, I'm going to get X dollars an hour for 40 hours a week, and totally be naive about, no, you're going to spend 20 of those hours every week just managing your organization, and you'll be lucky if you're the director of an organization to get any more billable hours, so to speak, than the 20. So that's where then you run into these programs that are just completely unprepared to really deliver the services that the families expect.
And in the field, our field, BCBA, is the credential that parents are taught to look for, but the BCBA really is just the minimum standard of, okay, I passed this exam. It doesn't really talk about quality and experience. So how can a family, if they see somebody who's got a BCBA, how can they, interview that person and make sure that they had good supervision, they had good schooling, and again, that they're not, right out of school. How can they discern some of those items?
Well, and that's that I was kind of alluding to what I was talking about a second ago. sounded probably a lot more like I was speaking to providers, but to parents, exactly what you just said, Mary. The BCBA credential is meant to say, I've been through my initial training phase, like going to graduate school, getting the supervision I would in graduate school, and now I'm ready to work for somebody, is really the way we think of it, rather than I'm ready to take a charge and direct my own program. It's in our program, we expect many more years of experience delivering direct services to parents and children before they're even ready to start supervising other staff. And it's probably a nightmare for families to walk into a center, like you said, thinking, well, this is just another office, they're all the same, and realize these people have zero clue what they're doing. And you hear about it all the time. They're well-meaning people, went to school, went to a prestigious organization, but they've only worked hands-on with a child for often less than a year's time, and they're just not ready to provide the sophistication each individual child needs in order to get their program the way it needs to be effective with each individual child.
So are you the clinical director of your program?
Mm-hmm.
And you have a PhD.
Mm-hmm.
And so at Little Star, our clinical director, our chief operating officer, but our clinical director is also a PhD. And I think it's also really confusing if people just look at titles, well, like, oh, this person is the clinical director, but titles don't, again, anybody can assign themselves a title. Our standards for what a chief clinical officer or clinical director or a PhD with this many years experience, and you can walk into another center and their clinical director has a BCBA and has been in the field for 6 months. Mm-hmm. So I think parents also, just need to be aware of that, not to let the title really kind of bamboozle them or just, to dig deeper.
Yeah.
Yeah.
And they may have, even if you look at how many years of experience they may have had 3 years of experience as a paraprofessional in the schools, and now they've gone and gotten their BCBA, so they really don't even have experience in applied behavior analysis beyond what the BCBA required. And they're really kind of shooting from the hip, and they're buying the platitudes that everybody wants to tell you about your child and running with them instead of really knowing how to innovate and individualize for your child's unique needs.
So if a parent is, looking across a couple different centers, are there any policies and procedures they should make sure the organization has in place that might be an indicator of the organizational stability, quality, attention to detail, that type of thing?
Well, I think the first thing you're looking at is really what is the level of overall supervision and monitoring that's going on. So you could have a whole bunch of lone rangers, each person, kind of like the schools. Your teacher is given an incredible amount of independence to just run her own show any way she feels every day, every year, and the teacher next door could be running things completely differently, and that's just what we take for granted in the schools. But applied behavior analysis for an organization really depends on everybody consistently implementing principles the same way and using the same approach, so that your child's not confused, getting jerked around from one approach to using reinforcement to another as they move between different staff, as is always going to happen in an organization. So how often does the people who are taking clinical responsibility for your child, how often do those people actually provide direct supervision to the staff who are working one-to-one with your child? That's a real measure, and some organizations, you ask them that question and they won't even have a clear answer. Another organization, it'll right off the top of their head, they're telling you, oh yeah, well exactly, what we do is we supervise a child X hours for every quarter or X minutes for every week. Whatever their system is, they can tell you, and they can show you the data that they collect on the effectiveness of their individual programs. And it's obvious that the supervisor monitors that data rather than just storing it in a fancy file cabinet.
You know, there's a lot of, I think, misconceptions out there about ABA, and what would you want to share with parents who have a child with autism about ABA that they might not know or have a misconception about?
Yeah, there's a lot. So I think really the first thing, just going back to that word about data and evaluation, is what applied behavior analysis is about is analyzing behavior. There's two of the words in the title. And what we're doing is we're paying attention to whether our philosophy about how you should deliver programming to a child is actually working for that individual child. So we're collecting actual, obviously meaningful data on your child's progress and evaluating whether what we're doing is effective. So we all want to teach in the most natural way possible, because then their skills generalize to all the natural activities of your family's life. But if that's not working, then we want to use more structure to make sure we're dialing down how we teach to the level where it actually matters to your child, where he'll actually respond. So when somebody says, well, I'm much more natural than that other program, or I'm much more structured than that other program, that's fine, but how's it working for the individual child? And what I would expect to see is one child's programming is much more natural than another child's because of the results with those two different children.
How does your organization train newly hired RBTs, registered behavior technicians? What's your training process like?
Well, we essentially train from within, so we very rarely would hire a BCBA from a graduate school program. We would be expecting, and we promote very heavily within our organization, that the youngest staff, who are the most novice, look at what we're doing as a career track, and after a year to 2 years of working one-to-one at the most junior level, they can apply for training to become a senior therapist, and then they're going to spend 6 months in training to be a senior therapist, and then maybe 5-6 years later after that they can apply to become a supervisor, and they're going to spend a year in training at that point to be a supervisor. But throughout that entire span of years, they're going to be getting observation, training, and direction on the different children they're working with on a weekly basis. So the staff person who's finally ready to supervise the work of others and design programs for other kids, that supervisor is going to have 6 years of experience being trained to work with different children, and then those more focused spans of treatment as they get promoted to those higher levels.
That's like amazing quality that you guys are putting into your staff, and it's just unmatched, you know.
And we owe it to the families. As you know, you start a program, you're desperate to get the help your child needs, and there's nobody there available to help you. And so a lot of the training, from my point of view, comes from the need to provide access to families who are out there in the cold and have no choices. And if I could just throw a bunch of people who are going to be making it up at you, and that's essentially what you get in a non-clinical setting like the public schools, is people are hired, they get a week of orientation, and now they're working with your kid. And probably every family that's watching this video is thinking, yeah, I know how that goes. And instead, we've got to make sure we're carefully training staff so we don't just replicate the same problems they were having in school.
So applied behavior analysis, it's a medically necessary treatment, but families are often told, no, you need to put your child into the school because they need to be around typical peers. And if they're in an ABA center, they're just going to be around, mostly other children with autism. What would you say to something like that?
Well, again, it comes back to that word, are we analyzing actually how effective that's working for you? And what we're typically seeing is children are in a regular program without much actual expertise being provided to their child. And usually in those regular programs, there's very minimal evaluation of the effectiveness of what's working for the child. So by going to an actual autism center that has a high level of quality, a high level of data collection and analysis and supervision, that program's making up for what you're losing by making sure that what you're getting is actual progress for your child. And we're talking about needing a lot of progress. We're not just looking at how well are we babysitting the child, which, safety, being well fed, being clean, those are all important things that any parent wants. But the reason to put your child in a center is to expect their progress is going to start to accelerate. And that takes a lot of careful focus and management. Is there anything that strikes you as that distinguishes you from other centers for me to jump on?
Oh, like you are our longevity, the layers of supervision that we have, the years of experience that the supervisors have, something like that. Yeah.
Sure. And in closing, if I say I got a child with autism and I'm moving to a new state, so I really don't know the lay of the land, I don't know who's a good provider and who isn't, I'm going to certainly start with looking for providers who are engaged with the national community that really are doing research themselves to further innovate and make their program more effective. But I'm also then going to look at, do they have a long track record with providing services to children where I'm moving, so that these people are not just running into all the challenges of how do you set up a program that's really going to work for each child, but they've been at it for a long time and now they're able to put the plans in place consistently in a predictable way, and I'm not going to be getting surprises every week and every month on, oh yeah, boy, that's a real problem. And that is unfortunately what some families are running into, is people are just sort of caught in the headlights.
Well, Eric, thank you so much for joining me, and thank you so much for being on our advisory board. Eric comes to Little Star in Carmel 3 times a year with our other advisory board members and has given us so much clinical expertise and just has made our organization so much better, so much higher quality, and I truly appreciate everything that you've done for us and your time this morning.
Appreciate what you're doing for all the kids.
Yeah. Well, thank you so much for joining us, and we'll see you on the next video.